Let's roll. Hi, this is Anne,
And this is Kerin.
and this is A Date with Dietitians. Welcome to our podcast. We are both registered dietitians and nutritionists, and we are really interested in what's going on right now with MAHA. Today, we're going to be talking about SNAP, which has been a big topic of news, and we're going to go through our segments today, but they are going to be kind of mixed up. But if you stay until the end of the little podcast, I will give you some great advice on how to get started eating healthy. Super easy, super not complicated. So, how are you today, Kerin? What's going
Great.
on with you?
Getting ready for Thanksgiving.
Mm-hmm.
That's it.
Me too. Yeah, I have Friendsgiving tomorrow, so I can't wait to
Oh,
see
you
what
are?
food is there. Yeah, I'm not having it here, but bringing scallop potatoes. And then we have our segments, which Kerin developed. So we have something tried, something true, something old, something new, dietitian's corner, and I also have a product review. Don't let me forget that. I can't wait to share that because I really love it. So yeah, let's start with SNAP. So first of all,
Okay.
what does SNAP stand for? Any guesses?
You want food and it's there.
SNAP. SNAP, there's food in my pantry. SNAP, my grocery cart is filled up. SNAP, my belly is full. Well, it didn't start off as SNAP, but what does the word SNAP? I wish that was true. I mean,
I know.
Instacart's pretty good, but
I know. Yeah.
I'm using the Walmart service, but it's not that quick, and I have to pay for it. But so what do you think SNAP stands for? You want to just take a stab at it, Kerin?
Supplemental Nutrition Assistance Program.
Very good, excellent.
Assistance, right?
And I didn't know that until I looked it up today myself. And the one part of that I have an issue with, I think, is the nutrition part. So we're going to talk about that.
And all of this
Yeah,
is through the U.S. Department of Agriculture,
correct.
right? Okay.
It's through the USDA. SNAP. We're not against SNAP, right? Why don't you say,
Yeah.
what is good? What are the positive things?
Yeah. SNAP is anything supplemental or assistance for people who need assistance with food, or, we don't want children to go hungry. Children, malnourished people who are infirmed, can't work, people with disabilities. But it seems like maybe a couple things are going on. It's been abused. Maybe people are using it that shouldn't be using it, and they're not.
Meaning the nutrition missions part.
The nutrition mission has been abandoned. Yeah.
That was abandoned. And I found something interesting I want to talk about at some point in here. But to go to the something old segment, let's do the history. Where did SNAP come
Love
from?
it.
Didn't
Yeah.
have such a snappy name in the beginning. They were literally orange food stamps. In 1939 to 1943, you could get stamps for surplus foods only, and you had to spend your own money to get these food stamps, and then it ended. So it was a temporary help for people during the war. Then in 1964, I think a lot of entitlement programs started around this time. Yeah, not a coincidence, I don't think.
Who was
But
president then?
Lyndon Johnson.
Oh,
Yeah,
oh,
of
right.
course. Yeah. That's a whole nother podcast.
Okay.
But in 1964, he did the Food Stamp Act, and that was kind of going county by county, because I guess it is managed by the USDA, which is agricultural or whatnot. But by the 1970s, it was nationwide. So there are requirements, which I looked up. What do you think the income requirement is? Do you have any, just a guess?
I would think it would be something around the poverty line.
It's actually 130% of the poverty lines. I mean, it's different for every county what that AMI, that poverty level is, the federal poverty level.
Hmm.
But I didn't look that up. I should have looked it up for our states, but I didn't. But there are requirements that, how many people are on it right now? Do you have a guess?
I don't.
And we have a little clip too from
I
the
don't.
new director, Brooke Rollins. I really like her a lot. So what I did find out, which is interesting, well, there's
Are
40
you
to
gonna
40.
tell me?
Yeah, yeah, sorry.
You're gonna
That
leave
was
me
gonna keep
hanging?
everybody in suspense. There's 40 to 45 million people on it. Why they don't know exactly is a mystery to me. I would think you could easily somehow look at a database and figure out how many people were on it. But it seems like some states don't cooperate very well. And we're going to listen to a clip here shortly. But I did find out what they call it. And this goes to my issue with the nutrition part. Some states have BBCE, which is broad-based categorical eligibility. So states can change the eligibility and what's allowed however they see fit. So I thought that was interesting. I also
And they're
have,
allowed to do that just based on
I guess, how it's set up for the
mm.
states to decide how they want to manage it. But I'd like to know.
And the government just gives them whatever they ask for
Mhm.
and funds.
Mhm. Or they, yeah, they disperse it, I guess. They make
So
their
they're
own
like, "Hey,
eligibility.
we need double what our neighbors next door need."
Yeah,
So if South
they
Carolina was like, "We need more than North Carolina, and this
mhm,
is why," even though
mhm,
our parameters are more lax,
mhm.
the federal government says, "Okay."
What I would like to know, I mean, maybe you do know this offhand, or I wish I could look it up real quick. What what percentage of the population is obese? I would think it'd be the same among, I mean, I'd like to know if SNAP recipients have a higher obesity level than the general population. I'm just curious about that.
Hmm.
So anyway, that's the history of it, and that's where we are today. And then I think we're gonna listen to a little bit of, did you have
Well,
a
you skipped over EBT, so it went from food stamps, then it was
okay.
a couple different things, right? I remember
You
when I was in college, it was a big deal when it changed to the EBT card
EBT.
because they were like, "We shouldn't have to be embarrassed
Mhm.
to pull out food
Yes.
stamps, and we want a debit card like everybody else," right?
Yes, and they said it would help with fraud, but I think it probably, I don't know, probably makes it easier.
I wonder. That's right, they did sell it on the fact that it would help with fraud, but yeah. The
I
one
if
thing
I needed food, I would not have any problem standing in front of anybody with actual food stamps. I mean, I at one point was on WIC and food stamps.
and that's something else. Do you wanna talk about what WIC is? That's with the USDA as well.
Is it?
It
I didn't look it
is.
up. It is. Well, WIC is something, yeah, I have a whole little section on WIC, but you
One thing I
wanna,
did wanna say that I did not realize, so SNAP, when you get that SNAP, you can go across the state line to other states and use your SNAP benefits. You're not supposed to, but you can. So say you
I didn't
move
even realize you were supposed to stay in your state. I did know this, that at the little bodega, the margarita mix had a big sign that said EBT eligible. So it's like margarita mix. I guess it's lime. I don't know. How does that qualify?
how does that qualify?
So I mean, that's kind of when it got into my consciousness of being annoying. Like, what? These people with these EBT cards are buying margarita mix with my money? Like, I don't like that.
Hmm.
So, yeah, so it went from actual stamps to different kind of stamps to the EBT debit card. Now it's a SNAP card and it sounds all snappy and happy, but you really are, I supposedly down and out on your luck if you're needing them. But you want to listen to a little bit of what?
Yeah. Now, you were gonna play a clip too about you had one clip that you showed me about that person, and they were, like, getting thousands of dollars worth of stuff, and I thought they were supposed to be if it's supplemental, it's like a couple hundred per month. So
It
how was
was,
that one family getting thousands of dollars?
I don't know. I know that one, I don't have that clip anymore, but I think she said it was $2,500.
And not one thing, every single thing in her that they were unloading was processed. Every
Mhm,
single
everything,
thing.
everything. There was nothing.
There was nothing that was, like, even
Mm-mm.
orange juice or milk. or
I don't know, maybe I can go back and add one of those clips to this somehow. I removed it because I
probably.
thought that person was, like, mentally ill or something.
Yeah. No, I'm thinking about the family that was unloading and putting it in the freezer, not the girl that was sitting in bed. It looked like
Yes.
2 families maybe. And they're like, "We just made a run," and they were loading up the freezer, and it was like Breyer's ice cream, high dollar stuff, Totino's pizza rolls.
Mhm.
And I was like thinking, first of all, that's not anyway, that didn't look like
Supplemental.
food insecurity to me. That sounds judgmental on my part. If I was food insecure, I would not be choosing Breyer's ice cream. That's all I'm
No.
saying. I'm not food insecure and I don't choose Breyer's ice cream.
No,
It's
and this
very
is how I
expensive, but also it's not very good for you. But also it's just not very good ice cream sometimes.
No, I
Anyway,
mean,
well,
that's the whole thing. I feel like we'll listen to her, and I just feel like there's so much abuse, like, okay, you might as well run
yeah.
into your neighbor's house and take all their food and run home.
Yeah. It's the same thing,
That's how
right?
I
You're
feel, like,
stealing.
you're taking my money to go buy Breyer's ice cream I can't I won't buy, or
Right.
I'm on a budget, like, that's
Yeah.
wrong. It's wrong. I mean, I'm limited in what I can buy because of my celiac, and we are gonna be talking a lot about that, and then start leaving recipes and maybe even have a little celiac spinoff, but you wanna
Okay,
listen?
so what were you gonna talk about?
I
WIC
was
or
gonna
no?
listen to, Rollins for a minute.
Okay, talk about Rollins, yep.
Okay, so I'm gonna put her on. Great.
So they're
So, what are
She
your
said
thoughts on that?
the program increased 40% under Biden. That's huge.
Percent. He was how many terms was he president?
1.
40,
40%.
40%. So, I'm guessing okay, I have questions about what she just said. What are the questions that popped into your mind?
Well, there's a lot of questions I have about the 186,000 dead. You know, I've lost both my parents, but recently, and just wondering about, like, are they still voting? Do people vote for them? People abusing the powers of their family members that passed on, taking their benefits. Not that
I
I'm not
mean,
saying that I did that, but I'm saying because I can't, but I'm
108,
uh,
and this is only from the red states.
yeah.
186,000 dead people are getting supplemental what do
And
you know
she
what the
said,
nutrition requirements are for a skeleton, Karen?
well, and I
I
think
mean,
too, I don't know if it was in that one, but they were saying the duplicates. Was that the
yeah,
one where
she
she was talking
did.
about the
She said
duplicates and then
there
it's
are people getting it in multiple
multiple
states.
states? Yeah.
So you can see how you
And
could
that's
make
just in the red states. So then I don't know if it was in that one or another one where she was saying, well, what she expected the blue states probably were doing is much more egregious.
and I would agree. I think they're probably the ones who have all these BBCE, the broad-based categorical eligibility. Because, like, I mean, I could decide I'm going to work 20 hours a week and go apply for SNAP. If I didn't have
Hmm.
assets, I guess I could. I mean, I think it's just too ripe for abuse. It's too easy, it seems like, to abuse. And the big thing about that is it's taking away food, supplemental food that people might really need that are not getting it.
Yeah.
So I feel like it's taking from the others who need it. And then I have another issue with it. I want to look at this little chart I pulled up from USDA,
Yeah.
if you don't mind
Yes.
me
Did
sharing.
you
And
wait? So I I do have this letter here.
yeah, were there any excerpts that you wanted to read
Uh,
from
Let me just look at it real
Secretary
quick.
Rollins' letter to all
Yes.
SNAP agencies from July? This is from July,
July 9th.
from Brooke
2025.
Rollins.
She said on March 20th, 2025. So this was sent everywhere,
Mm-hmm.
everywhere. President Trump issued an executive order 14243, stop waste, fund, fraud, and abuse by eliminating information silos.
I guess that
This
means no one's sharing.
this executive order required agency heads to, quote, take all necessary steps to the maximum extent consistent with law to ensure the federal government has unfettered access to comprehensive data from all state programs that receive federal funding, including, as appropriate, data generated by those programs, but maintained in third-party databases. The USDA is committed to effectuating this executive order with respect to all programs in its purview. And then she said the Food and Nutrition Services at the USDA works in partnership with the state agencies to provide nutrition assistance to Americans in need through the SNAP program. Yeah, SNAP. It is imperative that the USDA eliminates bureaucratic duplication and inefficiency and enhances the government ability not only to have point-in-time information, but also to detect overpayments and fraud. As noted in the May 6, 2025 announcement of the department plan to request these data from EBT processors, USDA is committed to ensuring appropriate and lawful participation in SNAP.
Sounds like they're on the right track.
But basically,
yeah.
I mean, to me, it was very pleasantly asking for all the states to comply and give us your data.
I mean, and
And
why
only the red states did it,
Mhm.
even
And
though it
why
was
wouldn't yeah, like, why wouldn't you
well,
wanna
because it was I mean, I think sometimes it showed some egregious violations of
Mhm. That's the
it
only
was
reason.
embarrassing, right? It would be embarrassing.
It's terrible. They should be required. I mean, I wanna know. I mean, it's federal money. Okay, so let's see what foods are typically purchased. See if I can get to this. And thank you, audience, because we're just learning all this technical stuff. So we appreciate your patience. Let's see, what do I want to share? And this is from actually the USDA. Okay. So this is from the USDA. Foods typically purchased by SNAP. Summary. Now, I'm not going to read all this crap. This is like
Mhm.
dietitian stuff, really. Key findings. I mean, was pretty good. 40 cents of every dollar spent on basic items. 20 cents was on sweet stuff. I mean, that's kind of a lot. That's 20% just in this summary. And the remaining was on prepared foods, dairy products, blah, blah, blah. There's a list down here, though.
Okay.
So you can see meat, poultry, seafood is number 1 and 19%. But what's number 2, Karen? Can you read number 2?
Sweetened beverages. I thought
I'm just gonna categorically say, I don't think you should be able to use Snap for soda. The end. I have an ethical thing with it because we're trying to make people
Now, are they
healthy.
lumping in like juicy juice and
Well, juice is separate. Juice is down here.
so that's all the sodas?
I
Yeah.
would say, yeah, all the weird drinks.
I thought
That's
you said soda was number 1
9.3. That was a
on a
different this is
different
yeah, that was a
that's
different
weird because a different chart had soda as number 1 item
this is
purchased.
2011, maybe the one I had.
Yes, you had a more updated one. And you know what? That was before the lobbyists got in there. I think the more updated one
Is
showed
correct.
yes, soda is number 1 now.
Sorry, people. This was like the most recent thing. I mean, okay, they better. This is bad
There's another one that's more recent that has soda as number 1
from
that we found.
USDA.
No, you found
That was
another
the one
chart.
I had yesterday that
Mm,
had soda as number 1. Well, whatever it is, it's number
yep,
1 and number 2. Do you think it should
yep.
be included in SNAP
I don't think it should
benefits?
be there at all. No.
No, because what?
It's a waste. That's not even supplemental and that's not nutrition. It's not.
This is from November
Just give them bags of
2016.
sugar. What do
This
you
is
need to give them?
okay. Here's a good example of nutrition lagging. Okay. This is November 2016, looking at 2011 data. What?
Yeah.
Okay. So my point is, okay, so let's say soda is number 1, which I think it is. I think soda and candy and fruit snacks and all that crap we all saw on all those videos. But my issue is it's giving kids obesity, diabetes. Like how is it okay? How is it okay?
Mhm.
Why do they allow it to be part of the supplemental nutrition? No answers?
I have nothing. I have
I
nothing.
mean, I don't know. I didn't have soda. My kids didn't drink soda. Which brings me to let's see. I would like to know how many people are obese on Snap. There's got to be that somewhere. Maybe I'll do some follow up. Or is that
But,
somehow
obese doesn't mean healthy.
exactly? That's what I'm saying. Like, if you're allowing crap to be, you are causing kids to get sick. That's why I think it shouldn't be allowed. I can't think of one good reason. I think it's not ethical.
I
honestly.
mean, then they still may need SNAP, and they just need to not be allowed to have sugar. They need more fruits
Correct.
and
Yeah, I'm
vegetables
not
and
saying
meat.
take away SNAP. I'm
Okay.
saying
They s
no soda.
they
No
still may
soda,
may have food insecurity. They need meat.
yeah,
They need
no
meat.
sports
No.
drink, none of
Right.
that. So, which
Mhm.
brings me to my thoughts on WIC. I like WIC because
Well, of course we like WIC. We're gonna
we
be
both
partial to WIC.
we're partial to WIC, but it's specific and they have to reapply. And when I worked in WIC, those women stayed there all
So
day to get.
tell them what WIC is. Tell everyone what WIC is. It is
That's
very
right. I'm
specific.
sorry, people. Women, infants, and children. It's a supplemental nutrition program for women, infants, and children. It's limited to high protein foods. It's limited to pregnant women, nursing women, children under 5. They're supposed I need to look it up. They are supposed to get nutrition counseling when they go recertify,
Yeah.
which I think is a good thing. And I found most of my moms wanted to hear what I had to say. I kept it brief when they recertified. What do you think? Where I feel like SNAP people, they don't care. They're just
Yeah.
like, "Give me soda, give me."
'Cause she worked at I mean, I did it in my internship, worked with WIC and
I
FNO.
worked for WIC, and I made what I made at WIC made me eligible for WIC. Mhm. It's true.
'Cause she was not only working there, but she was eligible.
Yes. I was pregnant, and what they paid me made me eligible,
Yeah. Um,
but I was married,
and a
so.
lot of times it pays for necessary infant formula
Mhm.
or food for the breastfeeding mother while she's breastfeeding. But that being said, the food that it allows is very specific.
Mhm.
Like, it can be peanut butter or eggs or milk or cheese. Like you said, high protein.
Formula. I think it could be 100%. I mean, if you're in the grocery
If
store,
it's juice, it
you
has to be
might see
100%
WIC.
juice. Yeah.
You
It'll
might
say
see
WIC eligible. But yeah, it's not processed foods. You're not gonna see Totino's pizza. You're not gonna see
any soda.
soda, beer, steak.
You're not gonna see cigarettes.
You're not gonna see cigarettes. You're not gonna see Margaritaville. What did you say you saw at the bodega? Margaritaville
Margarita
mixer?
mix, powdered,
Powder.
powder, yeah. EBT eligible. I think that was when I
It's
lived off
very
of Buffalo Road
so
in Raleigh.
it just makes sense. I mean, all of the things on WIC to me makes sense. It's a good program, and I
And they
don't
get
understand
nutrition
why.
education. I
Yeah, and
mean,
then you get nutrition education. So I don't understand why SNAP
I don't
can't be
recipients feel like it's a burden to go recertify if I needed food, I'd go every week and sit in line. I
for
don't
your
understand that
babies. I
part.
don't know.
Hmm?
I don't know. Yeah, for your babies. So
No, even if, me, like, if I
right,
needed
that's
SNAP, I would
right. I'm
have no
saying,
problem sitting there and waiting
not
and
to mention, it should
recertifying.
be for a bridge.
Yes. It's not
It's
a
it's
generational
right.
passing on your SNAP. It's I don't know, maybe you put it in your
It's in the
will.
will.
I hereby
Put them in the will.
transfer all SNAP benefits, so I really think SNAP needs to be
Generational
revamped.
wealth.
Yeah, generational wealth starts with SNAP, not
Okay.
home ownership. SNAP. I mean, that is just
Uh,
it's okay, so I think SNAP needs a total redo.
so they're doing it right now. Did you
But
hear?
there's 29 states
She's
who aren't.
well, this is what I think she's gonna do. I think she's like, you know what? We don't at this point, we don't even care what you were doing.
Mhm.
This is what you're gonna do now, or you're not gonna get any money.
I think that's what they should
That's what
do.
she said. She said after Thanksgiving, I saw her being interviewed on news, I don't know. And she said, well, after Thanksgiving, we're going to have a proposal or something. And we're going to roll out a new plan. And this is how, and so he'll just say, you're not going to get any money if you don't use this new program. We don't even care what you were doing before.
And
That's
I
what I think
agree.
he's going to say.
Well, I think that's fair because
I think he's still going to try to get details from them of what crooked stuff
the
they were doing.
corruption
But
there's some bad corruption, like,
I don't think I don't think
professional
they're gonna
level.
yeah. I don't think they're gonna wait on it I don't know, maybe they will, but I still think they're gonna roll it out.
Well, I think the thing is now that it's gotten into the news because of the government shutdown was a blessing. Now everybody is well aware you're taking my money to
Yeah.
go buy crap
Mhm.
and you have long nails, your hair is done, and you're in a nice vehicle. Like, it's just, it's,
And they did it to themselves with all their videos that they
hmm
posted on social media. That didn't make things look good.
no, it doesn't look good. I mean, where's humility? Okay, well, I mean, do you have any other thoughts on SNAP? I have one thing for Dietitian's Corner. I have my advice coming up,
I don't.
and then I have my something tried, which I'm really
I
excited to
can't wait for
share.
okay, share it all.
Okay, so
What's
you all don't
Dietitian's
know this.
Corner?
Well, Dietitian's Corner's last. This is something
Okay.
tried.
Okay, do the tried.
I am a coffee addict, fiend, snob.
Connoisseur,
Yes, you name it.
not
Have
an
to have in
addict.
the French press, but I
Was
also
that
like hmm?
pour over? Do you like percolated, pour over, press?
French press, French
Okay.
press. And I also have been intrigued with mushrooms lately, not the psychedelic, that kind of thing, but just mushrooms. And I've tried different mushroom coffees. I don't know, for maybe the last 4 or 5 years because it's supposed to help with your clear your mind. So anyway, I found this great product and we're not being paid. Anything I endorse, I love and we use, right? If they want to pay us, we will take it.
You're just
But
telling about it.
I'm not advertising anything I don't use. So this is Rise Mushroom Coffee. My first advice is buy it directly from them. See, it's a cute martini thing. It's not
I like the why.
martini glass, but
Wonder
anyway,
why they did that. It does look like a martini glass
I don't know because you're waking
with a
up.
little like a yoga
Yeah,
position.
like yeah, you're rising. Woo!
Oh, that's what
So
it is.
that's what I think. I don't know. We'll have to ask them. Maybe the Rise people will see this and let us
Mhm.
know how you came up with such a cute,
It's so cute.
so cute.
So what did you notice different when you started drinking it?
Well, I wanna say what's in it, and
Okay.
I do wanna say buy it from them, not Amazon, because there's knockoffs,
Mhm.
and people are writing in and, who knows what's in that. So, anyway, what's in this, it's more than just coffee. It's got cordyceps for energy, reishi for mood, I love reishi, lion's mane for focus, shiitake for immune support, turkey tail for digestion, and king trumpet for longevity. So you get this. It comes in this really, I don't have the package, and I'm not going to make you suffer like a YouTube video and watch me open it, but it comes with this really cute
That is adorable.
Asahi wood
Look
container,
at
right?
that.
So you keep your coffee in there. And it also comes with a little Asahi wood measuring spoon and a spoon because you need to keep stirring it. And then what I got also comes with mushroom and probiotic coconut creamer. And there's
Mm.
also more in this. So the same mushrooms. But I will have to say, it's been 2 months. I feel like my bloating is really down. Okay, so this is what I do I drink 2 cups of this and then I drink 2 cups of regular coffee because I just can't give it up. So or the whole French press.
So both?
Yes, both. I'll have to say I do the, mushroom first, which is a big change for me, and there's been mornings I didn't have the real coffee.
2 cups of how many ounces are we talking?
Big. I mean, I
Okay.
drink 2 8-ounce of these mushroom coffees, and then I drink the whole French press.
2
Where'd you go?
2 cups of this size?
I'm gonna say it's a regular coffee cup. I'm gonna say
Okay.
6 ounces. But I feel my mind is more clear in the morning more quickly. I don't have as much bloating all day and at night. And I
Mhm.
do. I feel like I have better focus and it's delicious. So that's my something tried for the week. And
I
then
like it.
dietitian corner. What
I like it.
I love mushrooms and I like mushroom soup too. I'll have to post my recipe. It's so good.
Mhm.
Now for dietitian's corner, and then we'll wrap it up with my advice and what we're going to talk about
Okay.
next.
Okay.
I don't know if you've heard this, but I was like, this doesn't sound good to me because the WHO is involved. The WHO is introducing a new ICD code, ICD 11, for adult undernutrition. But
Hmm.
aren't there already ICD codes for malnutrition, undernutrition, Kaji
Yeah.
Walker?
Yeah.
Why does WHO need one? It just makes me suspicious. Like, are they gonna mark certain people? What anyway, that was and I don't know what
Hmm.
dietitians have done to their codes. When I was coding, we used the doctor's code, and that's how I got paid. There were no separate dietitian codes. We did physician first
They're
consult.
doing new codes. Yeah.
But I think it's stupid because probably the dietitian's codes don't pay as much. Like, I'm saying I did mine under the physician first consult code, and that there was a pay scale for that.
Well, it started
So
with diabetes education, right? Those were the
I don't
first
know.
codes.
I didn't keep
Then it
up with the ICD codes. I
and
didn't
then it went with and then it was eating disorder.
well, yeah, there were
So
codes
they've
for
been
that, but
tacking on
I was
for
using the
nutrition
physician
education.
codes, not a dietitian ICD.
Yeah. They're new ones all the time. But I don't know why there's one for
From who? I just think it's suspicious and a cause for concern.
I don't know why who is doing that.
Yeah, me neither. I'm gonna look into it because I think it's a cause for concern because they want us to eat bugs. And just
Yeah.
FYI, audience, human bodies, we can't metabolize bug exoskeletons. We don't have the
No.
enzymes. So don't think it's a health fad.
Don't
It's not.
no. We're not meant to eat bugs.
And then Karen, you want
Bugs
us?
are not a substitute for
No, bugs
protein.
are not
They're not a
food.
complete source of protein.
So I'm gonna give my advice that you all been waiting for, and then Karen, you're gonna tell everybody what we're gonna talk about next time because I think it's a
Okay.
timely topic. But here's my advice. I'm just gonna reiterate it again. To eat healthy, all you need to do is eat food, plain food, milk,
That's it.
steak.
Food. Carrots.
It's food. Just start with that. So what are we talking about next, Karen?
Creatine.
Mm-hmm. Yep.
Is it good? Is it not good? How much should you have?
Does it hurt your kidneys? And
Yeah, exactly.
I have thoughts on that. I've done some research, but I guess that's a wrap.
That's a
So
wrap.
bye bye until next time. Bye bye. Thank you so much. And we can't wait to see you again. And we hope this was
Yes.
helpful. And we'd love to hear your comments.
Yes. Yes.
And
Bye
if you're
bye.
on Snap, let us know like what you have to do, or I'd like to hear.
Yeah.
Okay, well, bye bye.